I'm Vanessa Beck. I grew up in a south suburb of Chicago, and I got involved in, well, I started noticing injustice and inequality at a really early age, because when my parents were married, my dad's a lawyer, we had a lot of money. After the divorce, we really struggled and, moved to, the wrong side of the tracks. And so I sort of always had this awareness of injustice, unfairness. And I went through, I did a little bit of environmental activism, and then when I was in my late teens and early 20s, I developed a chronic illness, and that's when I started battling with the healthcare system, even having insurance. I feel like my diagnosis was delayed because of having to wait for HMO approvals to see specialists. So, trouble kind of started then. Then I had problems being uninsured, or getting a job, but having a year-long waiting period before I could be covered. And there came a time finally where I was doing a community organizing internship, and I didn't have health care, and I got really, really sick, and I couldn't work anymore. I had to go back home, and I had COBRA that I was paying for from another job, but nobody would accept it because I was now in a different state, and I couldn't get charity care because I filled out some form wrong, and they said it would be like 3 more months before I could reapply. It's like I tried every single arena. I applied for Medicaid. They said, no, you're not disabled, you don't get Medicaid. Finally, because I wasn't getting health care, I got so sick that I did qualify for Medicare. I was shocked to find out that there was a 2-year waiting period before getting on Medicare, but I was low income enough that I got Medicaid. And so through all of these years, it's like the seed was planted when I first got sick, but I just became enraged and upset and just incredulous that I had to go through everything that I went through. And then I grew up, and then thinking that there were millions of people like me or in even worse situations. So I did some research and, felt like, okay, there has to be some answer to this problem, And that's when I discovered Healthcare Now, actually, and HR 676, the Expanded and Improved Medicare for All Act. And so immediately I started participating in the conference calls, the monthly conference calls, and I was in Florida at this time, and there was no group for me to join up with, but the conference calls still made me feel, okay, there's a movement, there's something going on. And then when I had to move back home to Chicago, right after Sicko came out, and I remember I was passing out flyers outside of the movie theater about this single payer, and I was by myself doing that, but shortly after, a few organizations held a forum on single payer, and I was like, this is it, like finally I'll be able to do something. And that's exactly what happened. It was a packed room, and some of us after the meeting were like, okay, we have to keep this momentum going, and we really have to organize and try to help build the movement for healthcare for all. And that's when Chicago Single Payer Action Network was born. We used to call ourselves C-SPAN, but C-SPAN actually found out and told us we couldn't call ourselves that anymore, and so we felt pretty important. So that was around 2007, and I'd been organizing consistently with them, just learning as I went along. And then I went to graduate school, studied a lot of community organizing, got a social work degree, and I knew that I wanted to work for single payer, and I knew that there weren't a lot of jobs, but I was in touch with Katie from Healthcare Now. I'm like, do you know of any single payer jobs? She's like, well, one's coming up. How would you feel about moving to Philly? If you wouldn't mind, you should apply. I applied, and as of about 2.5 weeks ago, I'm the new director of organizing for Healthcare Now. So I'm really excited just to do a lot of base building, and I'd like to see us have have networks, have chapters in every single state. And I really like how the Vermont Workers Center uses the healthcare as a human rights framework, because I think that's really, really powerful, and I think that it resonates, with most people who you talk to. Well, yeah, I like, the importance of telling your story. I mean, that's all I did at first. People would just be like, wow, your story. I mean, and I feel like, yeah, it is really important. Like, you just really connect with another human being when you hear what got them motivated, to do something. Yeah, I've been really, really impressed because, I really respect, some of the other people who we've heard from over this weekend, but I don't really think that putting that many resources into talking to business is a really good way to go. I think that engaging and helping the people get involved who are the most affected by the issue, which tends to be working class people. I really agree with the Vermont Workers Center that's key. So I felt inspired by what I've heard, by the fact that the Vermont Workers Center looks at the big picture, puts everything in a human rights framework and connects the dots between issues. Like the fact that you stayed true to your ideals and didn't let the bill go through without taking undocumented immigrants with you. I mean, I feel like this is something that we're going to face nationally, and I want to do the same thing and just not compromise on that. Like, you can't compromise on something like that. So, yeah, I feel like it's been inspiring being here. I did get to hear Jonathan talk in Chicago, because we helped host him on his tour when I was in Chicago. So this was expanded on what he was talking about. Well, I think other organizations, what we can take from what you all do is the one-on-one organizing. I think a lot of groups, while they have really great intentions, they sort of start to stagnate and not reach out to meet other people. They recognize the need to reach out to other people, but maybe don't really know how to do it. So, I think the surveys that you used, I think that's a tool that groups across the country can utilize to help build their groups and to help build the movement. And for the Vermont Workers Center, it's hard for me to really think of what else you should be doing, because it seems like you've been doing a really good job, sort of. Strategizing and building before you go to your legislature. I think I don't understand really quite enough about the structure of Vermont to be able to say too much, but it definitely sounds a lot different than the kind of government structures we have in other cities. I don't think it's worth bothering, honestly, lobbying your congressman in many states across the country. It made sense for you all to do it, but except during very, very specific strategic times, not really elsewhere. I don't know, I think if you guys just continue to connect the dots, and keep speaking, about what you're doing across the country, I think that would be a great service to the movement.